And I think multiple visits make sense because, one time you see and the doctor says come back in a year, I think that's not the right practice. If you have symptoms, you're giving them some medicine, you should see them more frequently.
Absolutely.
So part of it is also like, but if as patients, if you are not proactive, you will get tremendous difficulties. The system is still archaic.
That is true.
Navigating through this whole complex of medical care is very, very difficult. As a patient, sometimes I've felt myself going through so much, and I imagine I'm a doctor, and I still feel the system is so archaic, that if I am not proactive, things are not going to move,
It's true. And
and they're not going into the right direction.
so true. And it's a combination. Some of it is the, medical practice itself, but I think a larger part of it is all the hoops that the insurance adds to it. There's so many
Correct.
hard stops and extra hoops to jump because, oh, the insurance won't cover this, but if you jump this hoop, this hoop, this hoop, then maybe the insurance will cover it, or they'll say nope, you can do this instead. And I don't think people realize to what extent insurance controls things.
Yes, it definitely plays a very strong part in doctors' decision-making process. But again, I'm telling you that you, for example, Zoe, like if you go to your doctor, you're going to say, if you know that your condition needs special care, you have to ask your primary care doctor, is the dietitian available to me, doctor? Can you refer me to? Is a GI available for me? Because I think these symptoms are bothering me and I'm concerned. I want a gastroenterology referral. I want a dietitian referral. I want a psychologist referral. If you are not saying, this uh, proactively, you're going to sit. The primary care is going to see you, give you a prescription, tell you to come back in 6 months. 6 months have gone by, another 6 months have gone by, another. And you're suffering through the whole process. When a gastroenterologist could have easily done an endoscopy, colonoscopy, and if there's a diagnosis to be made, done it and solved it. Time and time again, patients are coming and telling me, I wish I was referred earlier.
So that's not going to happen
I wish I
automatically.
was referred to it.
So
And that's the problem.
primary care physician's not going to
You
say,
will.
hey, I think you need to see a gastroenterologist because of these symptoms. They're gonna try to, like, my doctor said, well, Zoe, we know that you need to lose weight. You're aware of that already. Here are some book resources, some research for you, and that's where we left it. So
Right. So let me tell you something. So now everybody's on these GLP-1 agonists, right? Because of the weight and all that. But we still have some older weight losing for weight loss medications like Orlistat, but nobody's mentioning them. Why not? By reducing fat absorption, those medicines in the past they were being used. Yes, you have to consider the side effects, you have to consider everything. But if Ozempic is not covered, if Wegovy and these are not GLP-1 agonists are not covered by insurance, there are other cheaper medicines which previously people have tried. If they can help you, if probiotics and prebiotics and Metamucil can help you, why are people not talking about these other ways of doing things?
yeah, they're focused on the flavor
Right?
of the
So
month.
my what right. And so unless we know that we have to ask these things. So the incentive sometimes for the primary care physician is to not make too many referral.
Mm,
If that is an incentive, it's counterproductive to you as patient.
yeah, yeah.
Correct? If they're looking at the doctors, primary care physician as gatekeepers who are not raising uh, the healthcare cost by reducing referrals to subspecialists, by reducing imaging studies, by reducing extra CTs and MRIs, then as a patient, unless you ask, unless you are strongly advocating for yourself, you are not going to move forward.
Okay, so that's good to know because I've always assumed that
That's
if I needed a referral, my doctor would simply refer me to where I needed to go, but that's not the case at
that is
all.
what's not gonna happen.
Okay.
No, it's not gonna happen. It's then depends on that primary care physician's own understanding of himself or herself. If they are humble enough to know that this is beyond them early on, then they would refer early on.